Hi everyone. I want to make just a quick little video to kind of wrap up the course. We're getting close to the end, and I want to make sure that everybody's on the right page as far as case studies. I'm going to start grading Lillian. Now Lillian is our borderline case. Then I'll proceed with your addiction question. I'll probably just, hand do the addictions or write feedback for that, but I will give audio for Lillian, and then go ahead and go on to Janet, and then we're going to finish up with Tommy. So I kind of just want to recap what we've gone through so far, and then how we kind of work all of the disorders. Now, when we first started off the course, we looked a little bit about how we define abnormal behavior and how we actually start our classification. So you've really gotten an idea about the diagnostical and statistical manual of mental disorders. And I do want to say this is a work in progress. You could see in your chapters with your chapter readings, they gave you examples of what was in the DSM-4 and then some of the changes we made to the DSM-5. So I hope it gives you guys an idea that it is a work in progress. We are constantly going in and reevaluating, looking at disorders, looking at the environment, looking at social context, and we look to see whether or not we need to make some of those changes. As clinicians, we have a way of giving each other information. If we're transferring a patient from one area to the next, say somebody from California comes to Florida and they're looking for a therapist, I could get their records and look at what a previous therapist or psychologist wrote in their case studies, and to see whether or not, and gain that information, whether or not they need to further on re-diagnosis those cases in certain situations. So okay, so when you look at how we place it down, we place it down on axes. So we have axis 1, 2, 3, 4, and 5. Axis 1 really gives examples of some of the disorders that you have been reading about and working on as far as your case studies. You look at PTSD, you look at examples like adjustment disorder, anxiety disorders, and we talked about the anxiety disorders. You look at the mood disorders. We looked at bipolar 1, bipolar 2. Your exams dealt with, the criteria for diagnosing. Those are clinical conditions. Those are conditions in which we look for treatment, causation, and those are clinical conditions that we can see progression in. We can go through and look at what we need to do, whether it's from a biological perspective, bettering medications like psychotropic medications, bettering the way that we look at our therapeutic treatments, our paradigms for how we treat. Those conditions. And then we get to personality disorders. You have the example of Lillian, who is our borderline. That actually falls on what we call axis 2, but it's not like a condition. Your personality is not a condition where we can just go in and give you a Zoloft and it's going to alleviate some of the personality traits that you display. Personality is the consistency of what you have been in the past, what you are now, and what you will be in the future. It is the uniqueness about yourself. And in some circumstances, individuals have social deficits in those particular areas. When you were reading, you noticed that there was cluster A, cluster B, and cluster C. And within looking at those particular clusters, and we're talking about the self, the self is the personality, you can see some social deficits, some areas of concern with borderlines. Having worked with them, it's black and white, no gray in the middle. They like you one minute, they hate you the next. There's an enormous amount of turmoil, within that personality dynamics. You look at antisocial personality disorder. There's huge amounts of social deficit, or what you call sociopaths, within that particular area. Not feeling that empathy, not feeling that remorse. Histrionics who feel like they're the kind of the drama queens. They have to be on stage. And you also, when you look at narcissist, and some of you may have been around someone who's narcissist. You think about how the grandiose sense of self that they see themselves in areas. So that's not a clinical condition, a condition in which we can make significant changes. Axis 3, we look at medical conditions because we have to take into consideration that Maybe some of the conditions are in the medical area may contribute to what the individual is experiencing from a clinical condition. And then axis 4, we look at psychosocial stressors. Look, the entire chapter was on stress. And then, of course, axis 5 is that global assessment functioning. How is that person functioning today? Because we have to make that judgment. We have to make a judgment whether or not they need to go inpatient, outpatient. What is going on right there? What is the level of care that the individual needs? So you can see with personality disorder and some of the other clinical conditions, disorders that you have been reading about, there is kind of a distinction between that. Now we're going to be getting into some unique disorders when we look at psychotic disorders, when we look at schizophrenia. And the main criteria for schizophrenia, the hallucinations and the delusions, those must be present. And we have made some changes with schizophrenia. We used to have subtypes of schizophrenia: paranoid, undifferentiated, catatonic, residual. So we kind of just lumped it all together because it was kind of a wastebasket of all the different subtypes. But the hallucinations and delusions must be present in that particular aspect of diagnosing. We look at disorganized behavior with individuals and disorganized speech. We call that word salad. And you look at the positive, negative. So kind of take a look at Janet. When you look at Janet, think about what is the primary aspect, what happened to kind of trigger and turn on those particular genes that kind of got the whole schizophrenic snowball rolling, and how she started to decompensate in her particular area. So what is that? I'm asking the question, what was the primary delusion with Janet? We look at childhood disorders. That kind of finishes up all of our grouping. That's where my area of expertise. I worked with autistic children, which we consider developmental disorders. We've even changed that category. We threw out Asperger's, and we look at now autism spectrum disorder, and we looked at some of the ADD, ADHD, of course ODD, and then conduct disorder. When we talk about childhood disorders, that's a separate section within the DSM, and we're looking at the onset of those particular disorders: infant, childhood, adolescent. And so we have a pretty strict criteria. Now, somebody asked me in class once, well, I was just recently diagnosed ADD, and I thought that was a childhood disorder. Yeah, some people skip through the grate, and they kind of manage themselves maybe through their childhood years, and then they start to have some difficulty maybe in a different area, and they can go back and get diagnosed. I cleared up a myth for someone a few summers ago. They thought when they turned 18, I'm not going to have ADHD anymore. It doesn't work that way. And what we know now about ADHD, their hereditary properties. So really take a look at some of the questions. Make sure you're answering the entire question within the case study. You guys are doing a fantastic job. I'm reading them like psychological reports, so you're doing a good job at looking at the symptomology to answer the questions. So I'm going to go in, I'll give the audio feedback on Lillian, our borderline, and we look at Janet, and we look at Tommy, and we look at enuresis and encopresis. So make sure you really understand the enuresis. And then I'll probably just give written feedback for the addictions. That's a good chapter as well with the addiction, because for the United States, we have a huge problem with opioid addiction. You've been hearing about that, so that's a good section to read. So just kind of wind things up, try to get those case studies in. Really look at the symptomology, make sure you answer the entire question that I'm asking, and I will get that feedback to you as soon as possible. You guys doing a great job. I've really enjoyed reading all of your responses to the case study. So keep up the good work, and I will give you some audio feedback. Good job.